Hello, this is Dr. David Green, CEO of the Florida Pain Network. Today's topic is the basics of migraines. Migraine is a chronic headache that affects people from a few hours anywhere up to 72 hours straight. It's a complicated and recurrent headache disorder. Most commonly occurs in women between the ages of 15 and 55. Most migraines become less severe and less frequent with age. Now, how common are they? 18% of women are affected and 8% of men. All in all, it's about 11% of the population. 30 million in the U.S. have at least one migraine per year. Every 10 seconds, someone in the U.S. goes to the ER with a headache or a migraine. 70% of those with migraines have a first-degree relative who suffers. If one parent suffers, there's a 40% chance a child will suffer. If both parents have migraines, the chance goes up to 90%. Over 90% of those with migraines are unable to work or function normally during the migraine headache. There's a lot we don't know about what causes migraines. We know that there's some genetics involved and some environmental causes. Imbalances in brain chemicals is one thing we do know leads to migraines. Serotonin levels do drop during the headaches. Low serotonin levels can trigger a migraine by letting too much blood flow through vessels that should be constricted, and this can induce a throbbing sensation. Typical triggers include various types of foods such as aged cheese, red wine, beer, whiskey, food additives, cold food, citrus foods, MSG, and possibly caffeine. Elevated stress levels, possibly barometric changes in weather, strong scents like perfume or paint, even hair accessories like a ponytail that are put on fairly tight, and then various forms of exercise. Poor posture, skipping meals, smoking, incidentally, can lead to migraines. Now, one small silver lining is that there is no evidence to clearly substantiate that chocolate is a trigger of migraine headaches. That is a myth. Now, symptoms may include unilateral head pain that is throbbing and aggravated by activity. An aura is a visual or sensory symptoms prior to the onset of the headache, such as photophobia or visual scintillation. 80% of people have no aura prior to a migraine. There's no real objective testing available. An MRI or a CAT scan is not going to say, aha, this person suffers from migraines. You should get one, though. The doctor will get one to rule out, badness like a tumor. A lot of it's diagnosed on patient history and pattern of symptoms. A migraine diary can be very helpful to know that how bad it is, how often it occurs, and the triggers. So making the diagnosis, the International Headache Society requires patients to have at least 5 attacks fulfilling 3 criteria. 1, 4 to 72 hour duration, at least 2 of these, unilateral, pulsating, moderate to severe pain, along with aggravation by or causing avoidance of routine physical activity, and at least 1 of these, nausea plus minus vomiting, or photophobia and phonophobia. Now, abortive treatment options means you're having a migraine, and this is going to help abort it. There are various triptans which target serotonin. These include almotriptan, elatriptan, frovatriptan, naratriptan, rizatriptan, sumatriptan, which is the most common, and then zolmitriptan. There's also nasal sprays like Migraine, there's Migraine, Cafergo, and then there's over-the-counter medications such as Advil migraine, Excedrin migraine, and Motrin migraine. A lot of these contain aspirin, Tylenol, caffeine. Narcotics can also help. Barbiturates may be effective. And then for the nausea associated with migraines, Reglan, Compazine, or Phenergan can be very beneficial. Now, when you look at preventive treatment options, these are obviously treatments designed to reduce the frequency of the migraine headaches. High blood pressure medications can be used off-label for this purpose, including beta blockers and calcium channel blockers. Antidepressants can be used off-label, including Elavil and Pamelor. Anti-seizure medications, once again off-label, gabapentin, Topamax, and Depakote. And then Sonomagran is a serotonin antagonist. Interventional treatments, the FDA has approved Botox injections for chronic migraines. They can be given at 3-month intervals. It's about 32 sites being injected in a 10-minute procedure. It is covered by insurance if certain medications have been tried and failed. It has to be chronic migraines, and these are defined as distinct and severe neurologic disorder characterized by those who have a history of migraine and suffer from headaches on 15 or more days per month, with headaches lasting 4 hours a day or longer. When they did the large study to get FDA approval, those treated with Botox averaged 8 to 9 fewer headache days per month compared to baseline. amazing outcomes. So the various different types of interventional treatments, in addition to Botox injections, include occipital nerve blocks, cervical facet injections, cervical epidural injections, sphenopalatine ganglion blocks, supratrochlear nerve blocks, supra or infraorbital nerve blocks, and then pulse radiofrequency ablation of the occipital nerves. Now here's some outcome studies. One looking at 100 patients receiving greater occipital nerve blocks. 53% achieved pain relief averaging 3 weeks. So obviously it would need to be repeated to get maximum benefit. This was a retrospective study utilizing a mixture of lidocaine and steroid. 54% of migraine patients reported being significantly better, and the duration lasted up to 6 months. Another one looking at supraorbital nerve blocks or greater occipital nerve blocks in combination, maximum of 10 injections, saw an 85% effectiveness rate for 6 months. Along with these effective injections, as a last resort, a patient can get a transcranial nerve stimulator, which is the same technology as spinal cord stimulators for recalcitrant low back or leg pain. They have been shown to work very well for migraine headaches. Essentially, you have a trial placed underneath the skin around the scalp, and if it provides migraine relief, then a permanent implant can be done, which is subcutaneous with a battery pack and a programmer, and that can last for years. I mean, the newest ones are rechargeable from outside the skin. The top non-operative pain management in Florida is through the Florida Pain Network. There are many clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors in the network. In the Tampa area, visit us at painmanagementtampa.com and then call us for more information and scheduling at 813-666-4399. I'm Dr. David Green with the Florida Pain Network. Your pain stops here.